Everybody that's here already, thank you for joining. This is the Art of Mindful Medicine. Today's show is with a very special guest and on a very cool topic. Again, I'm your host, Dr. Seth Gilson. I'm a biological dentist, a certified yoga teacher, speaker, and personal coach. And like I said, our very special guest is Roberto Portocarrero. He is a certified Ayurvedic practitioner. Roberto has a bachelor's degree in Ayurveda from the Ayurvedic College for Wellbeing. He is a yoga teacher with at least 500 hours of training and a Marma Point Therapeutics practitioner located near Miami, Florida. So, Roberto, thank you very much for joining us. And I'll just give you a second to introduce yourself, say hello, and then we'll get started.
Okay, great. So, like you said, I'm Roberto Portocarrero, and I've been a Ayurvedic practitioner in South Florida for the last 7 years, and I have a clinic, well, an office here that I do my consultations. I also do a little Ayurvedic lifestyle consulting course for those interested in wanting to learn more about Ayurveda and learning how to take the pulse and looking at the people's tongues and learning about herbs and all that. And besides that, I love yoga. I've been teaching yoga for over 12 years.
Awesome.
And you're welcome to look at my Facebook page. I've been putting 30-minute free yoga videos.
Wonderful.
So
That's
want to do that.
beautiful.
Yeah.
Awesome. Well, thank you for that. That's awesome. So the first thing I always start with is gratitude. So if you could please share with everybody 3 things that you're grateful for today.
Okay. One big thing that I'm grateful for is last year I had a little accident with my knee. So for 3 months I was in crutches. So just being able to walk right now is like so grateful for that.
Absolutely, I agree with that. That's great.
Having to be in crutches for 3 months is not good.
Yeah, I can imagine.
So, yeah. Other thing I'm grateful for is being able to uh, not work a 9 to 5. Sorry for you guys who work 9 to 5. Being able to set my own time, being able to set my own schedule, go on vacation, I'll go on vacation. So that's another thing I'm grateful. And the last thing I would say is my family, everything that I'm here because of my family, If it wasn't for my family, I wouldn't be in the situation I'm in now.
That's beautiful. Wonderful.
Yeah.
Okay, so now let's talk a little bit about you, your personal story, where you grew up, you and your family. What was a little bit of your childhood like?
Okay, so I was born in Nicaragua.
Okay.
It's a nice little country in Central America, beautiful country. But unfortunately, when I was 5, there was like a civil war going on. And then my parents thought it would be best to come to the United States. So I ended up going to Houston. I lived in Houston for a year. It was really tough because I was the only, not speaking English. It was really tough to go to school and all that. But, when you're a kid, you learn quick, And then after that, we moved to South Florida, to Miami. And I've been here, since then, all my life, like 35 years, 36 years.
Nice.
Yeah. So.
And how was that transition? I mean, I know you were very young, but how did that feel to you coming to? I mean, I don't know how profound it was for you at that age to moving to another country, but what do you remember that being like?
To tell you the truth, when I was a kid, I used to think of the United States like a big mansion for some reason. Oh, mansion, yeah. I didn't really think that much. But when I got here, it was tough. Like I said, I got bullied because I didn't speak English. Going to school was rough. But eventually, things got a little bit better. My parents, their financial situation got a little bit better because in the beginning they were struggling a little bit. My dad had to have 2 or 3 jobs just to, take care of the family. So, and sometimes I would wake up at 2 in the morning and help him deliver newspapers,
Wow.
because that's one of his jobs. So I learned the value of hard work since when I was like 10, I mean, it was rough, but like I said, I'm grateful for everything that's happened in my life.
Yeah.
You know, it's what's formed me right.
I was just gonna say it's brought you to where you are right now. So that's beautiful.
Exactly. Yes.
Um,
Hmm.
and are both of your parents from Nicaragua?
Both from Nicaragua. Yes.
Okay, wonderful,
And
wonderful.
I
So,
mean, and, and actually, they're retired and they went back to live over there because
oh
it's
yeah,
so nice. The beaches there are beautiful. There's a lot of yoga retreats. A lot of people do yoga retreats
uh
over
huh,
there because there's a lot of like very isolated beaches.
uh
That's
huh.
just perfect for that.
Wonderful,
You know.
wonderful. And do
So
you go back frequently?
I try to go once every 2 years.
Okay,
Yeah,
nice, very nice.
I
Um,
love it. I love it.
yeah, I can. I bet. And especially when you're saying there's beautiful beaches. I mean, it's hard. It's hard to. it's hard to dislike a
Yeah,
place with beautiful
yeah.
beaches.
And if you're in Spain, I mean, the waves are really, really over there.
hmm
So I'm not. I'm terrible at balance, but but the waves.
Beautiful. No, that's great. That's good. It's good for people that like to surf. So, when you were growing up in the United States, is there anything that you always thought you wanted to be when you grew up?
Um, Not really. I was ever since I was a kid, always living in the moment. So never like, oh, I want to be a doctor or I want to be a psychologist or I
hmm
want to be anything like that. I was a very like in the moment kind of person. You know,
hmm
I love sports. One thing about me is that I have a. We'll learn about this later, but I have a lot of pizza,
hmm
which is a fire element,
hmm
and everybody that has pizza has a lot of passion. Like everything they get into, they go in like 500%,
Yeah.
and that's a pattern in my life. Starting with tennis when I was a kid, I was sleeping with my tennis racket. I was so obsessed with tennis.
I know what that's like. I was like that with soccer. I grew up playing soccer. Um,
Yeah,
I strived to play professionally. I played Division One in college, but I had I remember in high school a little stuffed soccer ball that
yeah,
that was always in bed with me. So I know exactly what you mean. Um,
yeah.
all right,
So
so
I was always like that with everything.
that's
Hmm.
great. That's awesome. So yeah, that's definitely pita.
Yeah, 100%. Yeah, they
Um,
tend to be a little on the obsessive disorder side.
I
They tend to be
understand.
a little OCD sometimes.
Yeah, yeah,
Yeah.
I can understand that. Um, so, finishing up on your childhood, is there a specific impactful memory that you remember from childhood?
From childhood, my mom had a sister who was a nun, and she used to take me to this like a Catholic, housing for the elderly.
hmm
And for some reason, I was impacted by looking at 95-year-olds walking around, and I don't know, that just gave me like a feeling or a thought that this life is not forever. This is only a temporary
hmm
life. This is what I thought of when I was a child.
hmm
So from the beginning, I reminded that this is infinite. This is not forever.
Yes, very impermanent, exactly. And around how old were you when you
Yes.
realized that?
This was around 5 years old.
Oh wow. Okay, so it was about the time you moved
I was
here.
Yeah, yeah, around the time I moved here. Yeah.
Wonderful,
I
wonderful.
was very introspective kid. Yeah, very introspective.
I can relate to that completely. So, and through all that journey, moving to a new country and all these kind of I guess I mean as a kid, like what you said, it's very stressful to be in those kind of weird situations where you're made fun of and things like that. What inspired you to enter the health and medical field?
Well, it's a funny story. I didn't get into the health and medical field until like later on in my
hmm
career. Uh, that's because I discovered yoga. The first time I did yoga, there's this program called P90X. I don't know if you
I've
heard of
heard
that.
of it. Yep, I did it
It's
a
like
few
this
times.
famous workout at home. Yeah, and one of the workouts is called Yoga X.
Oh yes, I
So I'm
remember
like,
that. I
so
remember that. Yeah.
yeah. So I tried the Yoga X. It was one of the hard workouts in the whole series.
Mm-hmm.
I'm like, well, this is really good. But for some reason, I'm like, let me go deeper into this yoga, because I knew yoga wasn't just about the physical poses and all that.
Mm-hmm.
So I got deeper into the yoga stuff. I realized it's much more than just poses.
Of
So
course.
it's all about, union, yoga, connecting with the source,
Mm-hmm.
stuff like that. And I got into all the books. I started reading everything that I could get my hands
Uh-huh.
on, all the ancient scriptures, everything that you could. Like the obsessive person that I am, I got obsessive
Yeah,
with
yeah,
yoga,
yeah.
and that's where that's where Ayurveda started popping out, and and then I met my teacher, and
Wonderful.
from there it was just yeah.
Very cool. I just want to say hi to a few people. I know a few people are waving down in the comments there. Hi, Seema. I hope everybody's doing well. So really a workout is what inspired you to seek out what yoga was and
Yes.
kind of get into this whole. That's really cool, actually. And for those of us that don't know, because I then want to get into what influenced you to be an Ayurvedic practitioner, but for those that don't know, what is, very briefly, because obviously we're going to talk about it more, but what is Ayurveda?
Okay. Ayurveda, the simplest people explain it, is the science of life.
Mm-hmm.
Knowing how to. It's all based on the five elements. Five elements, which earth, water, fire, air, and ether.
Mm-hmm.
And we're made out of these five elements, and the world is made out of the five elements. So it's all about how do you interact with the outside world, and everybody's different. Somebody might be born more with a fire, and people, and they have to interact with the world differently. If you're
Mm-hmm.
gonna be fire, angry, irritable, and all that.
Uh-huh.
Somebody vata, let's say they have more air. That means they're gonna have more thoughts. They're
Mm-hmm.
gonna have more dry in the skin, more coldness at the body. So they have to. They more heat. They need more grounding.
Mm-hmm.
And then you have the kapha, which is the earth and water.
Earth and water, yeah.
And these people, they're like elephants. They're like elephants. They move slow. Everything in their body is slow. They could gain weight really fast.
Mm-hmm.
So a lot of heat, a lot of stimulation.
Mm-hmm.
So basically, Ayurveda is the thing you want to do is find out your constitution, find out what elements are, and then we could find out what the best lifestyle is for you, what the best foods for you, what the best herbs for you. So it's all about being the most vital that you can
Mm-hmm.
in this world.
Beautiful.
So it's like a handbook of life,
Yeah,
the little handbook of life.
yeah. The science of life. Yeah.
And it totally makes sense to me. That's why I decided I wanted to study it,
Mm-hmm.
because I saw it work for me personally in my own life,
Mm-hmm.
and now that I've been practicing, I've seen it work in many people's lives as well.
Mm-hmm.
So
So you discovered Ayurveda through yoga, of course.
I kept hearing Vata, Pitta, Kapha, and then I had become a vegetarian. But the problem is that I became a starchitarian.
Uh-huh.
I gained 50 pounds, believe it or not.
Mm-hmm.
Usually you don't think an overweight vegetarian, but it does happen.
Mm-hmm.
And so I started developing low back pain, and I had a big belly. So like imagine carrying around 50 pounds of extra weight in you,
Mm-hmm.
and with back pain. So I looked around and I looked for I saw an Ayurvedic practitioner. Name was Dr. Light Miller.
Mm-hmm.
So I went to her, and it was a beautiful session. She was so passionate, and she got me. I lost the 50 pounds in 3 months just by doing simple things, very, very simple things, nothing out of the ordinary.
That's impressive.
So
3 months, 50 pounds. Not like you said, not doing much. That's
yeah, and
that's
I
awesome.
wasn't even exercising much, but it was mostly through diet and simple practices, stuff like that.
Very cool. I'm just writing down some questions. Seema, we are definitely going to get to that question. What I'm going to try and do, everybody here that's watching, is at the end, we're going to finish the show, and then I'm going to invite you all to because we can only do this for an hour. So I'm going to invite you all to come into the next live. I'm going to restart a live so we can do a quick Q&A for maybe 10 or 15 minutes, something like that with Roberto. So definitely keep your questions coming, guys. And we're going to, after this live, I'm going to immediately after start another live so everybody can ask questions about these types of things, because I want to make sure we answer all of the questions that everybody has. Throughout all of this, I mean, because obviously you're living life and doing and working and doing other things as you're doing P90X, discovering yoga, and then through yoga you're hearing all these different terms, and you're like, what is that? What is this? And then you discover Ayurveda, and then you just like the very pizza, and you just jump right into it. So what are some of the significant things you had to overcome while doing all this? Because I mean, obviously you have work and life and things going on, and now you're trying to add this whole other aspect into your life and become an expert in it. So how do you, what were some of the challenges that you had during that time?
I would say people around me telling me, don't waste your time. This is, like they say, woo-woo science.
Mm-hmm.
It's like real science. Just go to the doctors. The doctors, for instance, with I try to help my parents as much as they can,
Mm-hmm.
but listen to what I say. Whatever their MD says, that's what they do,
Mm-hmm.
I mean, stuff like that, not being taken seriously, because sometimes yoga and Ayurveda is looked at as something like, far out there. But, but the reality is we've used herbal medicine and aromatherapy and food for millions of years.
Mm-hmm.
This whole thing is a new thing. It's a brand new thing. Less than 200 years, probably.
Mm-hmm.
So
You're talking about traditional, or
I would say,
like regular, normal, modern medicine.
yeah, modern medicine.
Okay.
Yeah,
Gotcha.
allopathic medicine.
Yes,
I
absolutely.
would say trying to convince the biggest problem is trying to educate people on what Ayurveda is,
Uh-huh.
and trying to get rid of all the mysticism,
Mm-hmm.
and breaking it down in simple terms.
Mm-hmm.
Which is not easy sometimes.
That makes sense to me, and that's something we're definitely going to get into all that in the last section of the interview, because all that's very, very interesting. And like I've said many times before, even on the show, I think there's a balance that needs to be found between Eastern and Western medicines. I mean, because modern technology is fantastic, but old traditional medicine that has been studied for thousands of years versus just a couple hundred years. Again, even though we have more technology now, something that's been studied and observed over thousands and thousands of years, you can't just push to the side, because all of this technology that we have now came from all of that. So, so what were some of the things that...
Like if I get into a car accident,
Go ahead.
No, I was gonna say, like, if into a car accident, they're not gonna want to see me. They're gonna want to go to a surgeon. It's so the technology is excellent. It's especially for diagnostic purposes. You can't beat the latest technology.
Mm-hmm. Absolutely. I mean, like, I think like we were talking on the phone the other day, and I was like, if you have to go to an ER, you want to be in the United States going to an ER.
Yeah.
So
I'm not gonna give you some passion flower or chamomile and you're gonna be okay. You need to go to the ER.
Exactly. So all the different technologies and schools of thought have their place, and I think it's just really important that we all put those things together to create a plan for an individual.
Yes, and work together with everything that you can. Don't say, oh, you can never take pharmaceuticals, or you can never. No, if you need to take a pharmaceutical, you take it if you have to.
Mm-hmm.
I always like to go the natural first, but if you have to take a pharmaceutical, then I'm all for it.
Yeah, absolutely. So through that process and the people kind of telling you like you don't want to get into this woo-woo medicine, kind of trying to deter you from that path, what are some of the things that motivated you to stay on course that really kept you fixated on what you wanted and what you believed in?
Yeah. First of all, the results in my own self, I saw results with me. And once I started seeing results with my clients, that's when I even got more motivated. I said, oh, this works. Especially clients that have come to me with They came to me with a bag of like 10 different pharmaceuticals that they were taking. And a year later, they're probably not taking, they're taking one
Mm-hmm.
out of 10, you
Yeah,
know? So, I mean, like success stories, that's what keeps me going. That's
absolutely.
what motivates me to keep,
That's beautiful. I mean,
you know.
I can completely understand that, especially living it yourself. I mean, you can't get a better
Exactly.
testimonial than
Because
talking
imagine
about
you're,
your own
of
experience.
course, imagine you're giving things and your clients are not getting any better. And you're going to be disappointed or like, you're not going to believe in Ayurveda.
Mm-hmm.
But since I've seen many clients get better, whether it's losing weight, whether it's digestive issues, whether it's anxiety, I've seen it. So
Beautiful.
it,
So what are some of the most common things you find with people that come in to see you nowadays?
well, nowadays with this whole quarantine and uncertainty we're living in,
Mm-hmm.
anxiety is the biggest for one thing.
Mm-hmm.
And anxiety affects every part of your body,
Mm-hmm.
especially your digestive system.
Ah,
So we have a
100%.
whole nervous system, our gut,
Mm-hmm.
the enteric nervous system called. So whenever you're anxious and you're eating or whether you're angry, guess what? Your food is not going to be digested well because we need to be in a nice calm state in order for the food to be digested. If
Mm-hmm.
we're like all over the place, we're gonna have IBS. We're gonna have acid reflux, all
Yeah,
that. So
things like
that's
leaky gut and things like that.
digestive issues are super common nowadays.
Mm-hmm. All right. So we're going to shift a little bit from what your journey's been, and I want to talk a little bit about mindfulness. So if you could explain to people what mindfulness, in your own words, what mindfulness is.
Okay, I don't like to say mindfulness. I like to call it mindlessness.
Okay.
Mindlessness because when too much in my
Uh
mind,
huh.
that's when things could get in trouble. So, to me, the whole point of meditation is to connect with your inner self, with your, with the universe, and the whole reason you meditate is to maintain that connection throughout the day.
Mm-hmm.
You know, so that's why they say it's good to meditate in the morning and meditate at night. So you start with a connection and then you end the day with a connection,
Mm-hmm.
and then in the middle you're supposed to be connected.
Mm-hmm.
To me, mindfulness is more like mindlessness,
Mm-hmm.
not being in the mind, just being in the present moment,
Mm-hmm.
taking like step by step everything that comes to me,
Mm-hmm.
doing one thing at a time, trying not to stress. Because in my past, I was a big worrier, to
Mm-hmm.
worry about everything. And what I realized is that everything gonna turn out okay. Everything will be okay.
Mm-hmm.
So worrying is just a big of emotion, a big waste of time.
Yeah, absolutely. I
You know.
completely agree. I literally just had a conversation with one of my best friends the other day that he was stressing about a few things going on. And I said, is anything going to change if you stress? Whether you do or don't stress, what's going to change?
Yeah,
And he goes, oh, yeah, you're right.
nothing.
Literally nothing's going to change. So obviously, you want to be
No,
aware of it and be
nothing changed.
conscious of the situation, but worrying and
Yes,
getting crazed about it is not worth it.
yes. There's a famous saying. Those people that go to AA, in the 12-step program, they say, "Grant me the serenity to accept things I cannot change, and the courage to change the things I can, and the wisdom to know the
Uh
difference."
huh.
So if you can change it, you can change it. If you can't change it, why worry about it?
Exactly.
Like a good,
100%.
like a great example, you're running late to work. You're 10, 15 minutes late. You're in traffic. What can you do about it?
Yeah,
Nothing.
exactly.
Just stay calm and keep going.
100%. Absolutely. So, how do you incorporate mindfulness into your daily life personally?
Mindfulness into my daily life. Like I said, um, this might sound harsh a little bit, but learn the art of not giving, not caring that much. The art of not being so emotional over one little topic.
Mm-hmm.
That's the main thing. Another great thing that I've learned is that you can make every meal into a meditation.
Oh,
Every time you
yeah.
eat, you have the opportunity to make it a meditation.
Mm-hmm.
I always tell my take right before you take a minute of breathing, just breathing in and out, just for 10 like 1 minute. That's
Mm-hmm.
it. You start eating right. There's this book called Prana Yoga, HRANI. It's about the yoga of how to eat mindfully.
Mm-hmm.
So one of the main things is being grateful for the people who made the food, for everybody who was involved in making the meal.
Mm-hmm.
That's the number one thing, being grateful. The next thing is breathing. And then the last thing is eating mindfully. So you eat nice and slow.
Mm-hmm.
You chew your food nice and slow. And that just doing that, those three little things is gonna save your nervous system, digestive system from all these issues. Because a lot of the times people are in their car, they're eating fast, they're watching TV, they're
Guilty.
worried,
Guilty.
and I'm guilty of that. It's not easy.
No, it's not easy, but you're right. I mean, when we eat and we focus we put our intentions on what we're doing. It also, I mean, it affects our
Yeah.
digestion because I mean, yes, what we're eating and things like that can give acid reflux. But if we're calm and not up here, like you said, going a million miles a minute and just eating a million miles a minute,
Yeah.
you're going to give your body the chance that it needs to focus on what it needs to do, and you're going to be much calmer while you're eating.
Yes. And just remember, your stomach doesn't teeth. So that's why
Yeah,
the more you chew, less your stomach has to work. The
exactly.
less work for your digestive.
100%. One of
So
the things.
that's why,
Go ahead.
yeah, go ahead.
Oh, I was.
No, that's why I say you can make eating into a meditation. You
Yeah.
can meditate 3 times a day if you
Hmm.
want, just through eating.
Yeah. Absolutely. And Seema, you're
Yeah.
definitely right. Kids need to know how to eat. It's very important because I mean, how and what we eat in our childhood it influences us for the rest of our lives. So,
Yes. Yes.
back to what you were saying.
I
Um,
remember. Yeah.
oh no, I was just going to say how I always talk about how digestion starts with the mouth. The enzymes in our mouth, the physical action of the mastication and chewing, that's all very, very important. And I'm, I haven't looked up these numbers, but I would venture to say that the majority of people do not chew their foods properly before we actually swallow. So that definitely affects digestion as well.
Yeah. Ayurveda, they actually say digestion starts with the hands because they say the best way to eat is with hands,
Mm-hmm.
you know. So once you touch the food in your hands, the digestive juices are
Because you're
already flowing.
salivating. Yeah.
And, exactly. So it all starts with the senses, starting with your touch, and then it goes through your digestive tract. Yeah.
Yeah, just like you were
So,
saying, we're made
you know,
of all the senses. So I think touching the food and seeing the food and all these different aspects is really important. And I know in Indian culture, they eat a lot with their hands too. So,
yeah. Yes. Like for instance, growing up, there was a lot of arguments in the dinner table, a lot of argument, and as a kid, that really affects your nervous system. And imagine you're eating, and uh, I definitely try to avoid any arguments while you're eating. Which is sometimes that people talk about financial issues and stuff like that, but it's not the time.
yeah, definitely not the time while you're eating. And I agree 100%. I mean, there's no room for that at the dinner table. Not that obviously I'm not saying we should be arguing about these things in the first place, but of course that's definitely not there is a time and place for it. Um,
Yeah.
so staying on mindfulness, now how would you say, or how would you explain that, how you incorporate that in the work that you do?
Work that I do. Well, before I see a client, uh, to do a little meditation, like a 1 or 2. Doesn't have to be a minute, 20 minutes, just like a meditation.
Mm-hmm.
Sometimes I like to burn a candle, just to get myself in the you know in the mood.
Mm-hmm.
And then when I see the client, I try to listen beyond his words. I try to, try to understand them beyond whatever he's coming out, whatever the word coming out of his mouth. I try deeper, and that's why I also recommend for clients to come themselves. Sometimes they go with their family, and willing. Sometimes they don't want to share everything because they're embarrassed or something like that. So it's always best to better connection to have a one-on-one consultation. 100%.
Absolutely.
So,
And so if you could recommend something that to a patient or client or just everybody watching, what's something that people can start doing right now to incorporate mindfulness into their life?
well, like I said, the three meals. Use the 3 meal meditation. Take one of breathing exercise for every meal. Um, Start in Ayurveda. We have it's called dinacharya, like a daily routine. So start doing daily rules in your life. For instance, a daily routine includes maybe a 10-minute meditation in the morning, breathing exercises. In the morning, we do a lot of oral hygiene. I know you probably have a lot to say about that, but like oil pulling, getting some coconut oil or sesame oil and swishing it around your mouth, 5 to 10 minutes, and then spitting it out. So start with a meditation, with oil pulling, and just gonna get your day in the right direction.
Yeah.
You're gonna go in the right direction.
Absolutely.
So
yeah, I mean, I completely agree.
And you don't have to meditate 1 hour in the morning or 1 hour at night.
Yeah.
It could be 5 minutes in the morning, 5 minutes during the day, and 5 minutes at night, just to get that connection.
And it just slows everything
these
down.
These are little things. Yes.
And like you
Now,
said, connecting with your breath.
Exactly. Some people, it's very hard for them to meditate. So for these people, I recommend doing some yoga poses because maybe their nervous system is a little too, they're not ready to meditate. And what I found is that doing yoga, it prepares your body for meditation. It prepares your body for meditation, and yoga in itself is it's a moving meditation. So
yeah, absolutely. And that's one thing I try and explain to people a lot is that meditation, there's very many different types of meditation. It's not just sitting by yourself on a pillow in the middle of a room pretending like you're floating or something like that. I mean, from walking meditations, eating meditations, like you said, driving meditations. I mean, there's many forms of meditation, and it's just about being present. And like you said, when people have trouble understanding what meditation is, I tell them it's not about turning your brain off. You're not going to do that. It's just about intentionally focusing on something like your breath, for example, and just keeping your focus there. And then when you lose that focus, the awareness of losing that focus is mindful meditation. Bring your attention back to whatever it is, whether it's your breath or something specific that you want to think about. I mean, it's just being intentional with your focus.
Yes. Yeah, I believe there's a lot of strategies to get into meditation. One of the strategies exercises. And to me, the most important breathing exercise, especially if you're anxious, is the breathing exercise with a 1-to-2 ratio. So that means breathing in, let's say for 5 seconds, you want to breathe out for 10 seconds. Like that little mechanism. Because what happens when, let's say you get into an accident or a cop is going to tell you some bad news. The first thing he says, I want you to take a deep breath. I want you to take a deep breath. So right there, it's telling us that the breath has a lot to do with our mind. There's a big connection with the breath and the mind.
Oh, absolutely. I think
so just breathe.
Our breath is directly connected to our nervous system. It's our way to actually control some of the aspects to our body that we believe are uncontrollable, like heart rate and things like that. I mean, you can literally slow your heart rate. You can calm your nerves. And just like you said, take a few deep breaths before eating. It directly affects our nervous system and centers us.
Yeah, yeah, yeah. And apart from that, how to remain mindful. There's so many practices in Ayurveda that show how to remain mindful. One of the practices we do is oiling ourselves, oiling our body. It's called abhyanga, and you could do this after the shower, before the shower. You just want to keep the oils in your body for at least 15 minutes, and then it starts to absorb into your bloodstream. But this oils is like giving yourself a big hug. You're like giving yourself a big hug. You feel grounded. You're protecting yourself from negative energy around you. It's just a very, very good practice to do.
Absolutely.
Oiling.
Absolutely. So I want to shift a little bit more into Ayurveda because I really want to give it a good amount of attention today. So let's start off with Ayurveda. So how old is Ayurveda? Roughly.
Oof, Ayurveda is somewhere between roughly 4,000 to 6,000 years old. I mean, you can't say exactly,
Of course, yeah.
but Ayurveda, they say it's the mother of all healing systems. That this is one of the first healing systems ever known to man. And the first time they talked about Ayurveda was in the Indian scriptures. There's a script, the Vedas, and I believe the Rig Veda, one of the first scriptures ever known to man. They started talking about herbs and they started talking about Vata constitution. So it's very, very old.
Wonderful.
So what's so good about Ayurveda that it's over 5,000 years old and it's still popular today. So that tells you something. That tells you something that it works.
Oh yeah,
It's not like a fad.
And from my understanding of how Ayurveda was originated, or how I can imagine it being originated, is just through observation. I mean, experiment and observation. I mean, and it's not, we're still human beings, just like we were thousands of years ago. Yes, of course, there's some changes because that evolution that we go through is constantly happening, but we're still human beings. So that the things that were relevant then are always going to be relevant for us human beings.
Yes. And these ancient sages and Ayurvedic doctors, they used to, like you said, they were observing and they used to observe animals and what kind of herbs were these animals using to get better. They used to observe that.
Absolutely.
Just so through meditating, they were able to, discover things that like in modern technology weren't discovered only 200 years ago, but Ayurveda was talking about them a long time ago.
Absolutely. So actually, like what one of the doctors watching, Seema, she was saying that that's where I believe she what did she say? She said something. I can't find where it is. So that we can. It's easier now to understand Ayurveda because modern science is used to prove that which is what's already been known from thousands of years ago. So it's easier for people to accept Ayurveda now.
Yes. Yeah. Yeah. The beautiful thing about Ayurveda is that we're using diagnostics. Just like Chinese medicine, we use the tongue and we use the pulse. The pulse is very important. There's 7 different layers in the pulse, and each layer tells you, like for instance, the first layer tells you your general imbalance. The second layer tells you the sub doshas, because every dosha has 5 different functions. The layer tells you the state of the tissues. The fourth layer tells you the state of your organs. And then the 7th tells you your original constitution. So the pulse is like a gem of information. So much information contained in the pulse. It's amazing.
You just need to know how to read it or find the information you're looking for.
You need to know
exactly.
You need to know how to read the data.
And don't worry, people, if you didn't understand what some of that was, doshas and things like that. We're going to get into that right now. So we're going to talk about a few of these things. But before that, so Ayurveda is obviously created or came about or originated in Eastern countries. So how is Ayurveda viewed now in Eastern countries, and what are some of the greatest differences between that type of Eastern mentality and Western medicine?
Um, well, in India, Ayurveda has been around for so long. And if you go to India, you're gonna have in every corner you're gonna see an Ayurvedic hospital and stuff like that. The good thing about in India is that they've integrated Western medicine with Eastern medicine. So a lot of the doctors in India that studied Ayurveda, they're also MDs. They also study Western medicine. So they're using both. They're using the best of Western medicine and the best of Ayurveda.
That's beautiful.
That's how it is. For a long time in India, the British they burned down most of the Ayurvedic colleges because they wanted to bring in their Western medicine, you know.
No
But
better way to go and introduce something new. Just destroy what's already there, right?
everything. But luckily, you know, the little families and they kept some of the ancient scriptures and they hid them. And luckily, right now, Ayurveda is booming in India. And so Deepak Chopra, he's that person that brought one of the main persons that brought Ayurveda to the West. You know, also my teacher, Dr. Light Miller, she's one of the first pioneers of Ayurveda here in the United States as well.
Wonderful.
So, but like I said, to me, it's all about education, about educating people and what Ayurveda is all about. Because a lot of people, like I said, they might think it's woo woo science or it's yoga. It's too much mysticism. But the beautiful thing is Ayurveda is for everyone, whether you're a yogi or you're not a yogi. Whether you're a vegetarian, you're not a vegetarian. We can all benefit through Ayurveda.
Yeah, and vegetarian, veganism, and all these terms. I mean, from my understanding, Ayurveda actually uses milk and butters in a lot of treatments and things. So it's not about just being plant based. It also it has to do with a lot of the culture.
Yes. They worship the cow, and they use the milk from the cow, because most of their diet is lacto vegetarian. So that means that they're vegetarian. They use mostly milk and ghee. The ghee is clarified butter, and according to Ayurveda, that clarified butter is one of the best nourishing to the nervous system, to the brain, because in Ayurveda, we need lubrication in our body too, and the ghee is one of the best lubricants ever. I mean, to the body, that's known to man. So
yeah, and I believe also when they use milk, don't they usually cook the milk first?
I mean, to me, the best milk that you can buy is raw milk, raw milk, because what happens is when the milk is pasteurized, they heat it up and they get rid of all the most of the beneficial enzymes, and a lot of the vitamin A, D, and K are rid of as well.
Yeah.
So raw milk is the best milk. Yeah.
Gotcha.
But if you buy organic milk in the supermarket, we recommend to boil it a little bit to get rid of some of the toxins, and you could add spices to it, so it's so heavy on your system, like cinnamon, ginger, stuff.
Very good. So now what you had mentioned before, the dosha test. So what is a dosha test, and how important is this test with regard to knowing your body?
Yes. Well, there's a lot of dosha quizzes online, but it's very subjective, and you might be close. The best way to find out your dosha is through the pulse. This is the best way. You're not the pulse is not gonna lie, and because if you look at a person's body type, you might be looking at their balance and not their constitution. So just a little rundown. Everybody's born with a combination of vata, pitta, and kapha, right? So somebody might have more vata than another person, and they might be considered a vata constitution. Even though they still have pitta and kapha, they have more vata. So you would say that person has a vata constitution. Okay. Now, some people are born with dual doshas. Let's say you have a lot of vata constitution, but the pitta is close second.
Mm-hmm.
So those people will be called vata pitta constitution.
Mm-hmm.
And then you could have pitta vata, you could have kapha vata. There's endless combinations, but that's more important to find out your original constitution. And the
Mm-hmm.
best way to do that is the pulse
Mm-hmm.
in the seventh layer.
Mm-hmm.
That's the way you can find out.
Mm-hmm.
So we're born with this constitution, but throughout the years, according to what we eat, according to our lifestyle, let's say you were born pita, but now you've been eating a lot of sweets, you haven't been working out, so now you're kapha.
Mm-hmm.
Now your body, now you gained 50 pounds, so you have a kapha body.
Mm-hmm.
So in Ayurveda, we always want to go back to our original constitution because
Mm-hmm.
that's when we feel at our best. So if you're pita, you want to be pita. If you're kapha, you want kapha. That's when you feel your. It's not about balancing all the three doshas and having all the three doshas equal. It's about being your original self.
Oh, that's beautiful. That
Just
so
like in
that
yoga,
I didn't know that part actually.
Yeah. Yes.
So people, I mean, we change throughout life. I mean, it's really important for people to understand that we have all of these three different types within us. It's just in different proportions. So it's not like you're just one and you don't have any of the other.
Every living being, whether it's plants, animals, or humans, have the three doshas. Because without the three doshas, there wouldn't be life.
Mm-hmm.
It's what makes life happen.
Mm-hmm.
Doshas. So you have the vata, which is the movement, the way your blood moves, the way your food moves, the way your thoughts move,
Mm-hmm.
the way the blood moves. Everything that moves inside your body is vata. So everybody has to have it, right?
Mm-hmm.
Then ta is the fire, and our body is the fire is all the enzymes, all the hormones.
Which one was the fire?
The fire is what pita.
Pita. Okay.
So yeah, so pita. So pita is all the enzymes in our breaks down the food and turns it into energy. Without that fire, we can't break down the food into energy.
Mm-hmm.
So, and then we have the kapha, which is all the lubrication inside our body, the mucus, the lining around the lungs, the lining around the uterus, everything that's there for protection is kapha. So, like everybody has those three.
Mm-hmm.
It's like, and we're constantly in an interplay. They're interplaying with each other.
Yeah.
So
Beautiful.
yeah.
Beautiful. So I think that's a great introduction to a little bit about what doshas are and how important they are to identify, because from my understanding, again, based on that identification, you prescribe treatments per se or herbs and things like that based off of that, and nutrition profiles and things like that.
Yes. So the first thing I do when I see somebody is the main thing is you want to look at their constitution. What's their original constitution? Because then you have a plan. You want to get them back to the original constitution. Okay. So, but a lot of them imbalances, like I said, it could be the food, it could be through the lifestyle, and then the second thing is finding out what the imbalance is. So let's say somebody was born mostly pita, and right now, just to let you know, right now we live in a vata world. So much information, so much movement, everybody's moving. So vata tends to be out of balance on almost everybody, right? So let's say you were born pita, but you have a vata imbalance. What does that look like? A vata imbalance: anxiety, dry skin, constipation, dry hair, heart palpitations, any kind of pain is a vata imbalance. So when they come to me with all these symptoms, I already know in my head we need to start lowering the down. We need to start doing a vata reducing diet and a reducing lifestyle, and then little by little start going back to their original.
Beautiful. Awesome. So we have just under 10 minutes, and I know something you really wanted to talk about, and we mentioned it a little earlier, was stress and anxiety and how Ayurveda can help with that.
Yes. Well, perfectly, since we're talking about vata, the main constitution that's too high when people are stressed and anxiety is vata. So we have to work with the vata constitution, and like I said, vata has different qualities. It has a quality of dryness, of lightness, or very light, of coldness and irregularity. So it's irregular. You know. So if it has a quality of light, in Ayurveda we treat with opposites. So if you're light, you need heavy foods. Instead of eat for a Vata person, eating salads all day is not good for them.
Mm-hmm.
They need more warm, soupy, nourishing, nutrient dense because they need that extra warmth and that grounding.
Mm-hmm. I was just going to say that
As
helps
far
grounding.
Yes, it helps with the grounding.
Mm-hmm.
They need, like I said, I get treats with opposites. Like the qualities of Vata is, then guess what they need? They need more pungent foods. They need exercise. They need to get heated up, warm foods. So you want to avoid cold and dry foods with them.
Mm-hmm.
Another thing, quality is a dryness. They need more lubrication. You know,
Mm-hmm.
This is super important. And lubrication could be externally or internally. So all the good oils, like olive oil, coconut oil, avocado oil, nuts, the more they can have of that, the better.
Beautiful.
So
And
that's
that
gonna
that was
be
for which one?
for the vatas.
Vatas. Okay.
Yeah.
Perfect. Um,
With anxiety, the main constitution that's out of balance is vata. We have to lower the vata.
Makes sense. Okay. Um, so speaking of I know we talked about a little bit of treatment and herbs and things like that. What are some of the most known herbs in Ayurveda?
Well, the one of the most herbs for anxiety in Ayurveda, and now it's actually becoming very famous in the West, is called ashwagandha.
Mm-hmm.
You've heard of
Oh yeah.
ashwagandha? Yeah. So ashwagandha, yeah, does many things, but for the nervous system is one of the best nervous system rejuvenators.
Mm-hmm.
The only thing that it really takes 2 weeks for it to start working. So you have to take it for a period of 2 weeks so you can start seeing the results.
Mm-hmm.
Ashwagandha use it for a lot of things. They use it for, let's say you get into an accident, you have cancer, anything. Anytime you're weak and your nervous system is weak, ashwagandha just lifts you up. It gives you strength to the whole nervous system.
Mm-hmm.
And it's also called the Viagra because it's great for all sexual functions and all
Mm-hmm.
that. Infertility, ashwagandha you can't beat.
Wonderful.
So, yeah.
So just thinking about when one of the things that I always find that people ask me when you talk about herbs and things like that, it's like, all right, I understand these things can be really good for me, but what about I'm taking all these medications? Can I take
Yeah.
these things with it? So how do you address things like that?
Yeah, well, before I give every herb has a contradiction, like contraindication, sorry.
Mm-hmm.
And most of the herbs I deal with have no contraindications, but some do.
Mm-hmm.
Like especially when you're dealing with high blood pressure medication,
Mm-hmm.
you got to be really careful with that.
Mm-hmm.
And another thing, you never want to tell somebody to stop taking their medication.
Mm-hmm.
You always want to tell them to talk to their doctor, because sometimes we do things together. They're taking the medication and I'm giving the herbs, making sure the herbs have no contraindication.
Mm-hmm.
And from there, as their symptoms get better, I tell them to go to their doctor and see if they can start lowering them.
Exactly.
So, but I never tell a client to don't take that medication, take this herb.
Yeah, exactly. And I mean, and like you said, over time you can slowly start to wean people down off of their medications.
Yes, and you could work with the doctors. I work with some doctors,
Mm-hmm.
and I have clients that we work together. And I've gotten, not that I've gotten people off, but clients have gotten off their diabetes medication, their high blood pressure
Mm-hmm.
medication, just through diet and herbs.
Yeah, yeah, absolutely. So there's a few things that I'd really want to touch on before we end because we just have a few minutes left. What would you say if someone's interested in coming in for a consultation, something like that? What's just a brief rundown of what there is to expect?
Okay, so consultation, what to expect. The first thing to expect is the way that I look at things is I look at the pulse. So I'm gonna be looking at your pulse, and then from there I'm gonna get a lot of information. The other thing I look at is the tongue.
Mm-hmm.
The tongue is like a map of your organs,
Mm-hmm.
and you see so many things in the tongue. And you could see if there's inflammation. You could see if there's malabsorption.
Mm-hmm.
So I do the diagnostic like that. I look at the tongue. I look at the pulse, and then from there, obviously, I'm going to ask you about your history, what's going on,
Mm-hmm.
and then I prepare a protocol for you, including what foods to avoid, what foods to favor.
Mm-hmm.
I might recommend some herbs. I might recommend some oils. Sometimes I recommend different marma points
Mm-hmm.
because marma points are little chakras all over your body.
Mm-hmm.
And sometimes, like for instance, this marma point right here,
Mm-hmm.
this this marma point controls your digestive fire.
Mm-hmm.
So people who are having digestive issues or who need to lose weight, I tell them to press on this point.
Mm-hmm.
You know,
Very cool.
and so stuff like that. I
Okay.
give them some herbs, some oils, and some different recommendations that can help.
Awesome, awesome. I think that's wonderful. So we're going to start recapping. I mean, sorry, not recapping. Finishing up. But I do want to let everybody know that I am going to end this live and then again go into another one where Roberto and I are going to do a quick Q&A and maybe touch on a couple other things. So if everybody's still interested in learning a few other things about Ayurveda, because there's there's a lot of really cool aspects to this. And we can do a quick, just like 10, 15 minutes of a Q&A. So I'm going to end this video in just a couple of minutes, and then we're going to go right into another live. So everybody that's watching, just wait for that live to start again and come right back in. So in closing, if you could only share 3 things that people can implement into their lives right now, what would they be?
Okay.
We got
Mindful
a
eating.
minute.
Yeah. Mindful eating. That would be number one.
Mm-hmm.
Exercise.
Mm-hmm.
Exercise. Super important. And going out in the sun,
Yes.
getting some sun.
Beautiful.
So mindful eating, exercise, and sun. Those are 3 of the things that I recommend the
Awesome,
most.
awesome. I completely vibe with those things. So quickly, give us a recap of your business and social media and how people can find you.
So great. I have an office here in Hallandale Beach, Florida. And also, if you can't make it down here, I can do Zoom as well. I do
Mm-hmm.
Zoom consultations as well. And you could find me I have a website, ayurvology.com.
Mm-hmm.
I have an Instagram, Ayurvology, and I have a YouTube page, Ayurvology as well.
Perfect.
And one last, do offer training for those people that are interested in becoming Ayurvedic lifestyle consultants. It's a 25-hour course, and you could schedule one at your convenience. So you could do it in a month, you could finish in a month, finish in a year. It's all up to you.
Awesome. That's beautiful. So I want to thank everybody for watching. This is an awesome episode. Remember, we're going to go right into another live right after this. You can see all previous episodes on my YouTube channel, The Art of Mindful Medicine. You can check out my website, www.mindful.doctor. We're here on Instagram Live Saturdays at 12 Eastern. And just for a quote, I always end with a quote. This is from Eckhart Tolle. The secret to finding the deeper level in the other is finding the deeper level in yourself. Without finding it in yourself, you cannot see it in another. All right, thanks everybody. Hope everybody's having an awesome Saturday. Stay awesome, stay mindful. All right, awesome. So we're gonna just let a couple other people join in here. And I know we had one question. I'm gonna let people, as people are coming in, just write your questions in the comments. Everybody just write your questions and we'll get to them in the order that they come in. But I do want to touch up on a couple of things that we didn't really get to, unfortunately, talk in depth about in the first part of this, about the herbs and things. So those are some of the treatment modalities are the herbs. But what are some of the other types of treatment modalities that you use?
For like as far as so we use, like I talked a little bit about the marma points.
Mm-hmm.
Um, sometimes when I see a client, I just tell them to. I give them 4 or 5 marmot points that they could press at home.
Mm-hmm.
But I also do treatment where I open up all the marmot points in the body.
Okay.
107 marmot points in the body, and the treatment involves like cleaning up each marmot point using essential oils. Sometimes you use heat, sometimes you use cold, depends on the condition.
Mm-hmm.
Marmot points is a great treatment that we use. Uh, Ayurveda believes in a lot of massage. So massaging your
I love
body, you could do,
that.
yeah, Ayurvedic massage, any massage, just especially if you have anxiety, just to keep your body relaxed and stuff
Mm-hmm.
like that.
Absolutely.
Another thing that we use is, I know you wanted to talk about this, a panchakarma.
Mm-hmm.
So panchakarma is this intense detox.
Mm-hmm.
When you do a panchakarma, you don't wanna be going to work that same day. You wanna take some time off.
Mm-hmm.
The minimum panchakarma you want to do is at least 5 to 7 days, the
Mm-hmm.
minimum.
Mm-hmm.
The reason you don't want to work is because a lot of the times we carry a lot of toxins in our minds,
Mm-hmm.
and we want to get toxins in the mind as well.
Mm-hmm.
So panchakarma is 5. Pancha means 5. Karma means action.
Mm-hmm.
So it's 5 actions to get rid of toxins in the body.
Okay.
One of them is throwing up. There's a it's called vamana, is a throwing up there. You don't do that you do that with people who have a lot of mucus. When you have a lot of mucus in your lungs, a lot of mucus in your stomach, that's one of the best therapies. Then we have virechana, which is intestinal purgation, cleaning the intestines. Like if you have worms and parasites,
Mm-hmm.
that's one of the things. Then we have basti, which is like pretty much a colonic, but we don't use water. We use herbs, and then we use oil. And then we have this is called Rakta Mosha, which is bloodletting. We don't do that here in the United States because you have to have a special license for that. But sometimes just by going out and giving blood, donating blood, you're getting rid of blood.
Absolutely. I've heard of that. Actually, I know in Brazil, I've actually heard of this being done quite a bit where they take blood and then they'll just re-inject it right back into you.
Yeah.
Is one way of doing it, but also just giving blood, because then your body needs to replace that blood, so it stimulates new stem cell growth and things.
Yeah. Sometimes we have toxic blood. Sometimes we need to get rid of the excess blood.
Mm-hmm.
Ayurveda, they actually used to use leeches. They used to put the leeches directly in and suck the blood. I don't carry around leeches, so I'm not going to discuss, don't worry. But that's one of the things. And then the last action in Panchakarma is called Nasya. That's clearing all the passages in your head and your nasal, clearing the passages in your head, especially if you have allergies and stuff like that. That's an excellent treatment. So with this panchakarma, go ahead.
No, I was just going to say. So the 5 things, the 5 things for panchakarma. The first one was throwing up. What was the second one?
Intestinal purgation, like in cleaning the intestines. The third one is called basti, which is kind of like a colon cleanse. So kind of like we use different enemas. The fourth one is Rakta Mosha, which is bloodletting. And the fifth one is called Nasya, which is clean the channels in your mind, in your head.
So like the sinus passageways and things like that.
Yes.
Okay, gotcha. Okay, sorry, I didn't mean. What were you saying? Go ahead.
No, that I was saying that I've seen many miracles with people doing panchakarma. When I was doing it with my teacher, there was a lady that came in a wheelchair. She had rheumatoid arthritis so bad that she can't even walk. She did a 21-day karma, and I could say by the 21st day, I have film of it. She's actually she's walking around dancing like
that's awesome.
A person, So panchakarma is very, very effective, especially if you have like cancer, diabetes, like a very serious diseases. Panchakarma is recommended.
Wonderful.
Sure.
Awesome. So real quick, I know there's some people that joined in since we started this live. Please go ahead, thank you, Patty, for writing a question there. Everybody, ask your questions. I don't care how far-fetched you might think they are. We'll do our best to answer them. Just get the questions in there, write them in, and we'll address them as we go through. I just wanted to get through a few more topics with Roberto that we didn't get to finish on in the first part of the show. So like I said, just go ahead and write your questions in the comments. Did you have anything else that you wanted to say about the Panchakarma?
Well, like if you guys are looking for a panchakarma, one of my students runs a beautiful panchakarma in Puerto Rico, in this island called Vieques, and it's like one of the most beautiful hotels you're gonna be. It's like gay, and they have like amazing therapists there. So if you're looking to do a panchakarma, Puerto Rico is a place to be, and I could give you the information.
Awesome,
So,
awesome. Yeah, definitely people can reach out to you on social media and some of the other ways that you suggested in the first show, and you can share that information with them. Are there any other big types of treatments or things that you do or that is done in Ayurveda to that are different types of treatment modalities?
other types of treatments. So I mentioned Basti as part of like the Panchakarma. Basti means bathing. So we do a lot of different. So we do a Basti for the colon, but we also do Bastis for the hearts. We build a dam around here, and then we put specific oils. You're going through a lot of heartache, a lot of emotional trauma. We could put really nice healing oils right here in your heart center, and then it takes like 30 minutes of warm oils. It's super, super good. We do Bastis on the lower back. If you have low back pain, we build a dam, and then we put the oils, making sure that's in anti-inflammatory oils and stuff like that. And I mean, other treatments that I do specifically is the eye treatment. So in Ayurveda, one of the best ways to treat any kind of eye problems is called Netra Basti, which is a Basti in your eyes. The way I do it, I'll show. I'll show you right here. You could do this at home. You just get some goggles, just like this, and you put the ghee. You get the ghee because there's the treatment, and you clarify the ghee. You make sure it's water, and then you put it, and then you keep your eyes open with the ghee going inside your eyes. People have lowered their prescription glasses doing this treatment. It's just an overall good treatment for glaucoma, any kind of inflammation.
Really? So that's helpful with glaucoma too, even potentially. I mean,
yes.
Wonderful.
Yes.
So how many treatments does something like that normally take? Is that just like 1 or 2 treatments, or is that something that's ongoing for a month?
Well, depending how bad your eye disorder is.
Okay.
Like if you just have some minor issues, I would do it like once a week, But you could do this at home. You could do this at home. Another easier way, like if you don't want to get these goggles, you could buy one of these contoured eyeglass cups.
Oh, okay.
And then you put the key there, and then you go like
this.
Just
do one eye at a time, yeah.
5 at a time.
Yeah.
And you might want to do it at night because for like 30 minutes to an hour, everything's going to be a little hazy. But the next morning, I guarantee like the colors of is going to be so much brighter. It's amazing, this ghee treatment. So.
Beautiful. So everybody contact Roberto. Don't just go ahead and do this. To contact him and see how is best to do this for you. Don't just start putting random butter in your eyes and things like that. Again, we're just talking about different modalities of treatment and things like that. I wouldn't say this is going to cure you from anything right off the bat. I mean, just contact Roberto like he had mentioned before, and he can work with you on these things.
Yeah. I don't like to say it's going to cure you of anything, but it's definitely going to help. I've seen it.
Okay. So are there any other kind of prescribed treatments or anything like that you use quite often? Like I know you said for anxiety and things like that.
Yeah. For anxiety, to me, the main treatment is food. Food is like the biggest healer. Like Hippocrates, like everything starts with the food. You know, it's like for anxiety, you want a lot of grounding foods. Like I said, vata reducing food. So you want a lot of warm, soupy kind of foods. Um, a lot of oils because we need to lubricate the nervous system. So this could include ghee, coconut oil, avocado oil, nuts. Now, for extreme cases in Ayurveda, sometimes they recommend meats, but this is for extreme cases because imagine somebody who's like all jumping all over the place and like they say that meat is very grounding, but
Yeah,
I only recommend it to extreme cases and obviously the best quality meat, not cheap meat.
of course.
Um, yeah, other treatments that I do for anxiety are like Epsom salt baths. They're like one of the best things you could do. Epsom salt bath,
Full of magnesium. That
full
for
of magnesium.
sore
Yeah,
muscles and anxiety, yeah, absolutely. I mean, I've done that. I've had my parents do that, so that I definitely I know a little bit about that one.
yeah. And I also recommend some vitamins like magnesium glycinate. It's one of the best ones. Sometimes lack of vitamin B12, lack of vitamin B's could affect your brain. So vitamin B, a good vitamin B complex, especially if you're vegan or vegetarian, sometimes we're gonna be lacking on the vitamin B12. So you want some more vitamin B12 and B complex.
Awesome. So let's see.
Yeah.
I know we had a couple questions here. Patty asked the question: how often would we need to have a panchakarma, considering how toxic our environment is?
Okay. Well, in India, the kings used to have a panchakarma every change of season. So if you could afford it, you know, every change of season, it's recommended to do one. But realistically, once a year would be ideal.
Okay.
Once a year would be ideal. And one of the best things is when you do a daily routine. When you do a daily routine, it's like doing a daily detox. So you probably won't need a panchakarma if you follow a daily routine.
That's true. I can understand that. Um, and one of the other questions that we had early on from the first part of the show um, is regarding Ayurveda and the studies of Ayurveda. Where or how do you learn about Ayurveda, and is there a certification or a school? And I know that that's something that you actually just touched on at the end of the first episode about some of the courses and things that you do, or maybe like certifications and things like that. So how does all that work?
Well, Ayurveda, like if you wanted to learn Ayurveda, most of the times, like the usual, what people do is they go to school and usually 500 to 800 hours a program, and a lot of the schools are online. But there are some schools that you could actually go in person, like Sai University in Miami. You know, so if you want to be NAMA certified, which is a National Ayurvedic Medical Association, you want to go to one of these schools that have the NAMA certification, but you have to be there at least 500 to 800 hours.
Okay.
You know, so that's the main thing. What I take pride in my school is that I got all that information you learn in 3 or 4 years, and I've made it compact, and I've made it into 25 hours of study. Yeah. So the more you put into it, the more you're gonna get out of it.
Oh, that makes sense.
Yeah.
So I don't know if anybody has any other questions. Definitely write them in the comments. Just let them come. Don't be shy. So is there anything else that you specifically wanted to talk about beyond the stress and anxiety and things like that about Ayurveda?
Well, one of the main things is, you know, to learn more about it, get educated, learn about the vatas, vata, pitta, kapha. Learn about yourself, because the more you learn about Ayurveda, it's not just about learning about yourself. You know, so Ayurveda, like I said, is the handbook of life. Knowing how to interact with the outside world, knowing how your body works, what's good for your body and what's not good for your body. So, I mean, the more you learn, the more your life can get enhanced by Ayurveda.
Absolutely.
Yeah.
I can see that easily. So it looks like that's all the questions that we got for today. Again, I'll give you the opportunity for anybody. We still got a few people in here watching. Just let them know how to get in touch with you, and any other messages you want to give to people today.
Hey, great. Well, I want to appreciate everybody for joining us, and Dr. Seth, thank you for
Absolutely.
helping facilitate this interview. And you could reach me on my website, ayurvology.com. You could, like I said, I have an IG account with lots of information. On my website, I have a lot of articles too, if you want to learn more about, different Ayurveda procedures and all that. And just on my website, I have like my email, my phone number, if you can reach me. And I also have, don't forget to join my Facebook channel, but it's under Roberto, and I'm giving free yoga classes. I'm trying to put 1 or 2 a week. Yeah, so.
No, that's beautiful.
Yeah, that's it.
It looks like we got one more question here. How often do the constitutions change in an individual?
Well, your constitution stays with you for life. So it never changes. What changes is, so that's called prakriti. What changes is called the vikriti. It's your imbalance. So if you were born pitta, you could have a kapha imbalance, but you're still pitta, but you have a kapha imbalance. So your constitution never changes.
Okay.
So.
Awesome. I did not know that. So,
Yeah.
Shal, thank you for asking that question. That's a great question. And again, it doesn't look like we got any more coming in, but everybody definitely knows how to reach out to you.
You're welcome.
And yes, you are very welcome. And again, Roberto, thank you so much for coming on here. I appreciate you very, very much, taking your personal time to come on and share your experiences in life and what's led you to this point, and to just openly share the knowledge that you're sharing with people. I mean, it's beautiful. So thank you.
Yeah. Well, thank you so much too.
Absolutely. All right, everybody. Have an amazing Saturday. Have a great weekend. And again, thank you all for coming here and watching again. The Art of Mindful Medicine. I really, really appreciate it. And we will see you all next Saturday. Roberto, again, thank you very much. Have an awesome weekend.
Thank you. Namaste.
All right, guys. Namaste.
Thanks.